So good morning and welcome. My name is Chris Moyes, Councillor for Ward 13, Toronto Centre, and I'm also the Chair of the Board of Health. Before we begin, I'd like to take a moment to acknowledge the land we are on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge Toronto is covered by Treaty 13 with the Mississaugas of the Credit. As a Caribbean Canadian, I am committed to continually acting in solidarity with our African, Caribbean, and Black communities, seeking freedom and reparative justice in light of the history and ongoing legacy of slavery that continues to impact our communities across Canada. As part of this commitment, I would also like to acknowledge that not all people came to these lands as migrants and settlers. Specifically, I wish to acknowledge those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. In support of the City of Toronto's ongoing efforts to confront anti-Black racism, I pay tribute to those ancestors of African, Caribbean, and Black origin and descent. So I'm delighted to welcome you to Toronto City Hall today for a signing ceremony to formalize Toronto's inclusion in the Fast Track Cities Network. You can applause. And what better day than this World AIDS Day and the start of Indigenous AIDS Awareness Week in Canada. This morning, I'm joined by Mayor Olivia Chow, Dr. Eileen De Villa, Toronto's Medical Officer of Health, and Jose Zuniga, President and CEO of Fast Track Cities Network. Thank you for coming. Murray Jose Borridge, Director of the Toronto HIV Network and co-chair of Toronto to Zero, is also here with us today. Today is a time for reflection on lives lost and touched by HIV and AIDS, on the progress we've made in the city responding to the epidemic and renewing our commitment to ending it. I commend the efforts of individuals and organizations who are raising awareness, providing care, sharing knowledge and resources, and empowering their communities to reduce HIV stigma and promote health. We're at our best when we leave no one behind. That is what today's declaration signing is all about. The first speaker I'd like to introduce is Dr. Jose Zuniga. Dr. Zuniga earned a Master's of Public Health degree in Health Policy and a Doctorate of Philosophy in Human Development and Social Policy. He is one of the co-signers of the Paris Declaration on Fast Track Cities and spearhead the International Association of Providers of AIDS Care's efforts as the core technical partner for the Fast Track Cities initiative. Dr. Zuniga routinely advises United Nations health agencies, including the World Health Organization and its regional officers, as well as bilateral institutions such as the U.S. President's Emergency Plan for AIDS Relief. We welcome Dr. Zuniga.
Thank you very much for that kind introduction. I'm honored to be here in Toronto for the signing of the Paris Declaration on Fast Track Cities and welcoming this great city to the network of more than 500 cities. That you're doing it on World AIDS Day adds additional significance as we commemorate the loss of more than 40 million people globally since the start of this pandemic. 630,000 alone last year. Avoidable deaths, knowing that we have the tools at our disposal to prevent them. But it's also a day to recommit, given we have those tools, to supporting communities in a response to HIV. And as many of you are aware, the theme of this year's World AIDS Day is Let Communities Lead. They have been leading now for more than 4 decades. And it's important for us to continue to support their advocacy, their planning, their implementation, and it's important their monitoring of our HIV responses to make sure that we remain on track. The Fast Track Cities initiative was launched on World AIDS Day 2014, 9 years ago, with 26 initial cities signing the Paris Declaration. Today, we stand at over 500, and Toronto is joining this great network, not only to benefit from learning from other cities, but it's important in bidirectional exchanges to share your good practices, your experiences, the wealth of knowledge that you have from within your communities in your response. And in that respect, I'm immensely proud that you're signing on today. The Paris Declaration speaks to data-driven, equity-based, community-led HIV responses. I'm thrilled that your mayor and other officials are committing to continue that within the Toronto HIV response. Closing HIV gaps and addressing social determinants of health, including stigma, which create barriers to accessing and utilizing HIV services, but as important, deny people the best outcomes, health and otherwise. So we're here to support. We thank you for signing. We're here to support Toronto to Zero and look forward to hearing about your progress over the next year. Thank you.
Thank you so much, Dr. Zuniga. I would now like to introduce Murray Jose Burridge. Murray has worked at AIDS service organizations in Guelph, Cambridge, Kitchener, and Waterloo, Hamilton, and has served as Executive Director of the Toronto People with AIDS Foundation. He's also founding co-chair of the Ontario HIV Treatment Network and serves as the co-chair of the Toronto to Zero champion team. Welcome, Murray.
Thank you, Councillor Moyes, and good morning, everyone. Really excited and pleased to be here. 40 years ago, those of us from the HIV community could certainly never have dreamed that we would be in the places where we are now, you know, living full lives for some of us, fulfilling jobs, and contributing and expecting many more years to come. It just wasn't a part of our reality. And yet advancements in prevention and treatment have placed us in the situation where we are today. An understanding of inequities that are created and impact ongoing prevention and treatment and how to start breaking down those barriers is critical in our steps forward. Getting to this point today was an immense amount of work. There were 17 working groups comprised of more than 200 members, as well as community consultations, really bringing the wisdom of community researchers, policymakers, and others to the table and to the recommendations coming forward. I'm very excited and looking forward to re-engaging in ways to best support the work moving forward that meets these commitments and the city's commitments demonstrated by the signing of the Paris and Seville declarations. To my knowledge, the process is maybe the only fast-track city process led by two co-chairs, both directly from the HIV community, Darian Taylor and myself. And this is an important reflection in my mind to our ongoing desire and work towards meaningful community engagement. I'm encouraged by the renewed capacity of Toronto Public Health's contribution and leadership as a critical partner in the work following their required focus and response to the COVID-19 pandemic. While we have experienced some delays along the way, the work of Toronto to Zero has contributed to tangible benefits in Toronto, including just 3 initiatives that I'll mention involving collaboration across agencies to find different, more effective ways to deliver services. So the first, HQ Health Hub for Two-Spirit, gay, bisexual, and other men who have sex with men, offers easy access, on-site lab testing, allowing results within hours and immediate initiation of treatment for HIV and other STI treatments, as well as pre-exposure prophylaxis. An intensive case management program for members of the African, Caribbean, and Black community living with HIV is being offered at a Taibu's Community Health Center in Scarborough. And the Blue Door Clinic provides interim healthcare and social supports to people living with HIV in the Greater Toronto Area who do not have health insurance coverage or access to HIV medication. These are 3 critical and really impressive initiatives that have been moving forward, and these kinds of initiatives will only expand with the partnerships that we're now entering into. With these activities and other recommendations in mind, I know that we can not only contribute to, but leverage the Fast Track Cities Network membership, and I hope that our next generation of community will be able to look back, as I did in my opening comments, and say that that dreams they barely dared to hope for around HIV prevention and treatment are now a part of their reality of their lived experience. Thank you.
Thank you, Murray. Our next speaker, who needs no introduction at all, is our Chief Medical Officer of Health, Dr. Eileen de Villa.
Good morning.
Good morning.
I know it's a cloudy Friday morning. It is a beautiful morning. It is an especially beautiful morning, given what we are here to mark and celebrate today. So thank you all for being here today and for the kind introduction, Councillor Moyes. On behalf of Toronto Public Health, I welcome Dr. Zuniga to Toronto and look forward to the continued partnership between our two organizations, the Fast Track Cities Institute and Toronto Public Health. Central to our work in public health is an understanding of the social determinants of health. You heard Dr. Zuniga speak about this, and the interplay between social, structural, and systemic factors that affect health and drive health inequities. Communities most affected by HIV may have very different life experiences, but often share experiences of shame, of stigma, and of marginalization. By prioritizing access to testing, prevention, treatment, and care for everyone, and through close collaboration and a Team Toronto approach, we can address the inequities and inequalities that drive the HIV epidemic in our communities. In Toronto, we've seen a sustained increasing trend in reported HIV infections since 2016, with the exception being during the COVID-19 pandemic, where decreased STI testing was observed. As we transition, as Murray spoke to, as we transition from the emergency response phase of COVID-19 to a more sustainable future, Toronto Public Health seizes this moment to glean insights from other cities, share best practices, and work collaboratively towards innovative solutions. Together, we aim not only to meet, but surpass the 95-95-95 targets, setting a new standard for public health excellence. Ending HIV as a public health challenge will require a comprehensive and a community-engaged approach. And as Murray has shared, we have a terrific foundation upon which to build, thanks to the efforts of Toronto to Zero. So together, and now, as a fast-track city, let us pave the way for a future where our collective efforts today ensure a healthier, more equitable tomorrow for all. Thank you once again for being here, and I shall turn it back to you, Councillor Moyes.
Thank you, Dr. de Villa. And now I'm going to ask our amazing mayor to come up and say a few words.
Thank you. Good morning. Good morning. Recently, I was at the Art Gallery of Ontario to see Keith Harling's exhibition at the AGO. Harling created the famous artwork entitled Ignorance, Eco-Fear in 1989, a year after the initial World AIDS Day in 1988, the first ever Global Health Day. At that time, oh yeah, I'm short, thank you, but this might fall. It is falling. You know what? Okay, how about this? because this like to.
It's okay.
Yeah, okay. How about that? This is better? Okay. At that time, one American was being diagnosed with HIV every minute. Think about that, every minute. 4 people were dying of AIDS every hour. By 1991, the epidemic has claimed the lives of 100,000, just Americans alone. Here in Canada, things were tough, and the numbers were staggering. But because the city of Toronto worked very closely with the people on the front line, with the community, came up with the AIDS Defense Plan, our number is actually lower than a lot of major cities around the world. It was the community that stepped up, that put together the AIDS Defense Plan through the Board of Health. And now, all these years later, we find ourselves in a much more hopeful place, thanks to the benefits, as you said, of the benefits of the life-saving HIV treatment, scientific research that provides new options for prevention, and the collective impact of people living with HIV and their allies. Now, this year's World AIDS Day theme is Let Communities Lead. It's the only way. It's the best way. It's about the power of community engagement and community leadership. It's about involvement, from HIV organizing in the 1980s and the 90s to the more recent Mpox outbreak. When the community is at the center, there's nothing we cannot accomplish. I've seen it before. I know we could do it again. And the benefits are just enormous. And think back how we tackle COVID on the vaccination. Community-based and complete Team Toronto. So I think about, with this initiative, thinking about not just public health, our shelters, because there are some refugees coming in, a lot of refugees coming in, they wouldn't know what's available and what's there. Our libraries, our community centers, the agencies that partner with us because we provide grants. There are so many different aspects of the City of Toronto services that could come together because we are now a fast-track city. And today, we are hopeful. And because Toronto is a caring city, we showed our dedication to accelerate the response, whether it's identifying, treating, preventing, all of that. And it's a blessing. It's an honor for us to join the Global Alliance of Cities committed to ending the epidemic by 2030. Isn't that exciting? That's 6 years. 6 years from now. We have a shared vision of 0 new infections, 0 discrimination, 0 AIDS-related death. Wow. Think about it, imagine it, because we know we could do it. For decades, communities have shown up. Many of you are here. I recognize some of you here. Yes, I know I'm pointing at you. Because we know when we work together, we are stronger together. You provide the connection, the critical information, the resources. You develop trust. You help us to reach the undiagnosed. You help connect people to culturally safe services and support. This results in healthier Toronto. We are committed, as I said. It's not just a symbolic gesture because we're going to be signing something. It's easy to do. But it's a promise that our residents, to our neighbors, and the future generations, a promise to prioritize access to testing, prevention, treatment, and care for everyone. Yes, isn't it exciting? It's a promise to challenge stigma and discrimination, remove that shame, because through empathy and understanding, we can truly overcome the barriers that propel HIV and AIDS. Let's be safe, healthy, and caring city, a place where everyone belongs. Let's stay hopeful. Let's do this together. Thank you for being here.
Thank you, Mayor Chow. So now we're actually going to sign the declaration. So I'm going to ask Dr. Zuniga, Mayor Chow, and Dr. Allen Davila to sign the declaration. Mayor Chow will sign first. We'll invite Dr. Zuniga to sign second. Thank you. And now our Chief Medical Officer of Health, Dr. Eileen Davila. And now it's official. Thank you, everyone, for being here today. Some photos, I guess.